Welcome to our presentation on Thai culture and its nursing practice implications. Cultural competency is defined as a set of congruent behaviors, attitudes, and policies that come together enabling effective work in cross-cultural situations. This comes from Park Chesla, Rame, and Chun in 2011. Dr. Madeline Leninger, as the first nurse anthropologist, developed the theory of transcultural nursing. Her theory focuses on study, research, and practice dealing with people's culturally based beliefs, attitudes, values, behaviors, and practices related to health, illness, healing, and human caring. This comes from Andrews and Boyle in 2016. With the rapidly changing demographics of the United States, nurses have the opportunity to learn about other cultures to provide optimal patient-centered care. According to Park in 2011, empirical data suggests that lack of cultural competency increases misdiagnoses, inappropriate treatment choices, miscommunication between healthcare professionals and patients, errors in clinical practice, poor quality of care, and premature termination of treatment. End quote. Being a culturally competent nurse allows one to better serve vulnerable populations, especially those known to have disparities. This presentation focuses on the people of Thailand. According to the World Factbook from the Library of the Central Intelligence Agency in 2016, the Thai kingdom was founded in 1238. It was formerly known as Siam until 1939. Thailand is located in southeastern Asia. Its total land area is approximately 3 times the size of Florida. It has a tropical climate, and the total population is approximately 68 million people. As of 2010, ethnic groups consist of 95.9% Thai, 2% Burmese, 1.3% other, and 0.9% unspecified. The official language is Thai, with over 90% speaking it. Buddhism is the official country's religion, with 93.6% participation. Other faiths include Muslim, Christian, and other, from 4.9% on down to 0.39%. Total life expectancy is 74.43 years. The prevalence of HIV and AIDS in 2014 was 1.13% of the population. Infectious disease risk for the country is very high. The adult obesity level is low compared to other countries in the world. Literacy for age 15 and over is high at 96.7%. The economy is historically strong, only taking a recent dip due to political instability over 2013 to 2015. Current labor shortages attracts 24 million migrant workers from neighboring countries. As a part of the population, there are 129,000 Burmese refugees, approximately 35,000 internally displaced persons from the resurgence in ethno-nationalist violence, and 506,000 stateless persons, comprising at least one half of Thailand's Northern Hill tribe. Current challenges in Thailand include political unrest, trafficking in persons for forced labor, and sex trafficking, illicit drug manufacturing and transit, and ethno-nationalist violence focused on Muslims. Thai culture is varied as there are different religions, ethnicities, and languages of the people living in this population. There are some values and beliefs that coincide with healthcare, including greetings, social norms, religious beliefs, and Thai tradition. In greeting or leaving a Thai person, it is customary to put hands together as if praying and give a slight bow of the head. When communicating with members of the Thai population, creating conflict or displaying anger is unacceptable. One expected is to use a smile and be friendly, shying away from conflict. A social norm that may be challenged in the healthcare setting is the touching of the head. General touching of the head is considered rude. Health includes meditation and prayer for having a strong mind and a healthy body. Finding harmony in all things promotes healing, and medication helps in this purpose. Thai medicine includes Buddhist principles, cultural medicinal practices, and traditional philosophies. Herbal remedies and massage are main treatments. This comes from Roundy Chaudhary and Castro in 2011. Beliefs about dying include the person will be rebirthed to this life, Indra or another heaven, or another plane of existence. Buddhists have elaborate death rites performed by monks who chant sutras, perform a special bathing ritual, and lead a funeral procession which ends in the cremation 3 days after death. The culture defines disease as the expression of the disturbed harmony in our life as a whole. There are some nursing implications found for giving culturally sensitive nursing care for the Thai population in different age groups of the lifespan, from childbearing women and their families, children, adults, older adults, all the way down to communities. Childbearing women and their families have specific concerns related to culture. Due to political unrest and ethno-national insurgency, there has been a high incidence of violence that has been proven to take a toll on women in their pregnancies. According to Falb, McCormick, Hemingway, Anfinson, and Silverman, countries affected by war often have the highest rates of maternal mortality as armed conflicts interrupt and destroy health services and often occur within countries with poor pre-existing maternal health indicators. Falb also notes that women's experiences of victimization confer an increased risk of pregnancy morbidity due to direct physical injuries, negative health behaviors resulting from adverse coping mechanisms that are related to trauma, or poor mental health. End quote. Violence against women in the context of armed conflict, specifically sexual violence, in the conflict perpetrated by non-partners, has been linked to a range of reproductive health concerns, such as infertility, chronic abdominal pain, and abnormal vaginal bleeding. Intimate partner violence, including physical, sexual, and emotional abuse, is documented as rampant among women affected by armed conflict or political violence. Being aware of the special challenges that many women face in this population, nurses can assess for and discuss with their patients ways of coping and tend to the mother's physical and mental well-being. Thailand had a history of high maternal mortality rates. Since 1975, there have been significant improvements in maternal mortality rates with investments made in the district health system. Since Thailand borders on the Myanmar border, and there are a number of migrants and refugees coming over into the land, many of these women have health disparities comparing to the ones of their country of origin. Malaria is one of the infectious diseases that is seasonal and seriously affects childbearing women and their unborn infants. Because of widespread drug resistance to treatment, there is not a preventive cure available, Also, treatment options are limited as pharmaceutical cures are contraindicated in pregnancy. Migrant communities and refugees are more susceptible to the effects of malaria, as they often lack prenatal care and malarial screening for early detection. Nursing implications of a pregnant mother would include assessment for past malarial disease in order to evaluate the pregnancy in case of the effects of severe growth stunting or impending early demise of the fetus. Another widespread concern of childbearing women is the prevalence of vitamin D deficiency in Thailand. According to a 2015 study, 75.5% of pregnant women were found to be deficient in vitamin D, with 41.5% having severe insufficiency, and that is found from Pretumvinit et al. 2015. Factors that were associated with low vitamin D levels were low pre-pregnancy body mass index and what season the blood was collected in, whether it was winter versus rainy. Although Thailand has a tropical climate, and it would be thought that adequate vitamin D levels would be derived from the sunshine, during the rainy season most do not get adequate exposure. In addition, the Thai women's cultural preference of having a light skin color and staying indoors due to high levels of air pollution and lack of supplementation contribute to the problem. Maternal deficiency of vitamin D have been shown to be associated with preeclampsia, gestational diabetes, postpartum depression, preterm birth, and small for gestational age infants. Insufficiency of vitamin D in utero is associated with illnesses of wheezing, respiratory infection, type 1 diabetes, multiple sclerosis, and schizophrenia. Nurses can advocate for these patients to receive supplementation according to the level of vitamin D deficiency and monitor for effects of the deficiency. One area of health disparity indicated for Thai women is the lack of cervical and breast cancer screenings. As Asian Americans and Pacific Islanders are one of the fastest growing minority groups in the U.S., a study was done on the knowledge, attitudes, and beliefs regarding breast and cervical cancer screenings in 2010. The results were shocking, as this group had the highest incidence of mortality from breast cancer and had higher incidences of cervical cancer than any other racial group. And this comes from Deng, Lee, and Tran in 2010. Of particular concern in the Thai women studied, half were unemployed and, quote, 84.7% reported difficulties in the ability to pay for necessities, end quote. Most had access to health care and had health insurance and had heard about screening from the media or family, yet did not utilize screening services. Also, only 11.2% reported ever getting information on breast and cervical cancer screening from their health care providers, and most were unclear about symptoms, being in need of referral for screening, and had lack of knowledge of some key risk factors in developing breast and cervical cancer. Nurses can educate this population to bridge the gap in knowledge deficits related to breast and cervical cancer. Nurses can also teach about warning symptoms, in need for referral, and when and how to access screening services. Nurses can screen for economic issues, placing a barrier for care, enlisting the local resources available to promote health. Due to the poverty rate and living conditions in Thailand, many children are exposed to infectious diseases at a young age. Some of the most common infectious diseases found in Thai children are pneumonia, amoebic meningoencephalitis, enterotoxic Escherichia, Giannotti-Crosti syndrome, and giardiasis. This comes from Berger in 2016. Of all these can be fatal in a country that lacks adequate medical assistance. Education should be provided and reinforced to parents and children about proper hygiene and prevention of contraction of the most common diseases. For example, amoebas are often contracted through swimming in fresh, warm water. Although HIV and AIDS transmission has decreased from the previous years, the incidence of childhood AIDS and HIV remains a concern in Thailand. The government has attempted to help with providing antiretroviral medicine to pregnant women, but at least one child still gets the HIV virus from his or her mother every day in Thailand. Without access to antiretroviral medicines, nearly 50% of HIV infected children would die before they are 5 years old. Currently, there are approximately 14,000 children living with HIV in Thailand, and the majority of them receive antiretroviral medicine. And that it comes from UNICEF in Thailand in 2016. Education about transmission and early detection should be provided for women of childbearing years. Emotional support is a critical nursing implication that should be provided to these patients. Because of the poverty and poor living conditions of Thailand, many times children are sent to work at a young age. Although there are laws to aid in child protection, children are still being put to work, forced into prostitution, and being sold illegally. Despite government efforts to stop child labor, children in Thailand continue to engage in child labor in agriculture, including the shrimp and seafood processing sector, and in the worst forms of child labor, including in commercial sexual exploitation. And that comes from the U.S. Department of Labor in 2014. Adults 18 to 64 years of age are noted for being at the top of the family hierarchy. And according to Quintessential 2016, parents are at the very top of the hierarchy in Thai families. So for an implication for nurses, after receiving consent from the patient, nurses can include the family in decision making. Communication in the Thai culture places an emphasis on courtesy, politeness, respect, genial demeanor, and self-control. Etiquette rules are byproducts of religious culture, of Buddhism. Open criticism is considered a form of violence. When caring for adults with heritage, in the Thai culture, addressing a patient with respect and courtesy is of utmost importance. Nurses can address patients by first and last name and use formal greetings and goodbyes when communicating with patients and family. Nurses can be genial in facial expressions, communications, and actions. Conflict can be handled with a discussion of options, gently guiding a patient to his or her healthy expected outcomes. An open discussion of choices and consequences, leading a person to discover health-promoting behavior instead of criticism, is welcome. According to Dirochanawong and Ferrario in 2013, 71% of deaths are attributed to non-communicable diseases, 27% to cardiovascular disease, 12% to cancers, and 6% to diabetes, all of these resulting in mortality. discussing with the patient signs and symptoms of common diseases, and teaching health promotion factors such as diet, exercise, and regular screenings for cardiovascular health, diabetes awareness, and health changes are indicated. The current amount of Thai people with HIV and AIDS is approximately 450,000 people. Nurses can be advocates for health promotion teaching regarding sexually transmitted infections and how to protect oneself. Another component for those suffering with HIV and AIDS is to identify resources for medications, testing, counseling, and healthcare. Thailand is ranked highly on one of the most rapidly aging populations in the world. The number of people over the age of 60 now accounts for nearly 13% of Thailand's population. What sets Thailand apart from the other countries is the rate at which the demographics are changing. Quote, Thai old age population increased from 5 to 9% in 1960 to 2000 and is predicted to be 18% in 2020 from Narkinsorn and Kusakabi in 2013, end quote. The percentage shift happens about 3.5 times as fast as England. Of the population over the age of 60, only 15% indicate that they need some assistance with their daily living activities. And although Thai people believe in caring for their parents as they age, reality is that not all older people have the help of adult children. Historically, the elderly in Thailand are cared for by family, physically and financially. Due to economical necessity, younger working parents are unable to care for aging adults due to migration and economic requirements of the families. 50% of older Thai people do not have family in the same area, and 16% of older Thai individuals do not have living children. Family structure has changed with contemporary living, and instead of living as extended families, families now tend to live more as nuclear ones, thus leaving the elderly on their own. Due to poor financial state, many older adults in Thailand are at high risk of living in poverty. Not having the ability to work and already living in a low-income area, many older adults are unable to pay for necessities or medical expenses. Thai people who are able to work in their old age continue to do so. The National Statistical Office reports that 33% of older people still work daily, and 90.3% of them are working in informal sectors. One of the advantages of the majority of the Thai elderly have is that regular Buddhist temple attendance of at least once per week has been shown to decrease blood pressure. Nurses caring for this population will need to be especially sensitive to the economic concerns, changes in traditional structure of families, and the effects this has on the Thai people. Nurses can encourage Thai persons of the Buddhist faith to continue to regularly attend temple services and facilitate the practice of their religion as able in the last years of their lives. The Thai people as a community have a group of prevailing beliefs. 93.6% of Thai people are Buddhist, and this comes from the Central Intelligence Agency in 2010. They have the belief that life is not a single existence. However, one's past affects where one is currently in life. Disease is the expression of the disturbed harmony in our life as a whole. Finding harmony within relationships, nature, and oneself will enable one to be healed, and medicine serves to aid in this quest. One's mind can separate from the body, so an ill body can still have a healthy mind. Meditation and prayer will help achieve a strong mind. In conclusion, treating patients holistically is essential for all nurses in the 21st century. Holistic treatment includes asking about spiritual and religious beliefs that play a vital role in the patient's life. A nurse not only needs an open heart for patients, but an open mind in order to educate as needed for specific values within each culture. The previous slides were a brief introduction to the Thai culture. With patience and understanding, we can meet the needs of our patients with educating ourselves and asking questions when unaware of certain cultural practices. Thank you for listening to our presentation.